So, Cancer Val is back, and I'm going to talk about blood today. So, a couple of times in this process, particularly towards the end of the treatment cycle, I have been unable to have the chemo treatment because my blood work came back and I wasn't uh, in a place physically where I could have the treatment, which is is a little disappointing because you want it to be done and over with, and there's a problem. Now, the the blood work, the three elements, there are four elements, and I can't remember the fourth one, but there are three that I can remember that we're being focused on is the hemoglobin, the white blood cell count, and the platelets. Okay, and as you're taking in the chemo drugs, it's destroying everything in your body. Okay, it's destroying your immunity, it's destroying your blood's ability to rejuvenate. And not everybody's going to go through this. Some people are going to be fine, but you may get anemic. In my case, my hemoglobin at one point got down to 5, and it should never be that low. It should be, I felt fine, for the most part. I was feeling okay. I was getting around, but it's really, really dangerous. And you don't know that it's happening because it's your blood, right? You're not checking your blood every minute. So at one point, my platelets were down to a horrible level, critically low. All right, couldn't have chemo that time. White blood cells were low. So all it's a concert. You got to have a violin, and you got to have an oboe, and you got to have a cello, and you got your orchestra. And my orchestra was missing bits. I'd go to chemo, and the cello wasn't there. Of course, I'm joking about it, but it was pretty serious. And the only way that I could really tell, if that was a way to tell, was that I was out of breath, right? I was seriously out of breath where it would take me a good 5 minutes to recover, right? If I climbed some stairs or I did some sort of quick thing that I was working on, I would get out of breath really quickly and tired. In the beginning, you're tired because the chemo is so evasive and the cancer is so evasive, right? But as you progress through the treatments, the blood depletion part also creates symptoms that you're unaware of, all right? So new symptoms. So where you were tired and exhausted before because of the cancer, now you're tired and exhausted because your blood panel is way off or in a critical state, right? And there's no way of telling which is which, right? So as a result of that, right now, as of this moment, so I'm on 5 or 6 treatments, I've had 3 or 4 blood transfusions, and I've had a platelet transfusion, all right, in the emergency room. So that lends itself to a whole different set of problems, right? So because you can't continue treatment because you're physically not in a place where your body can manage it. The transfusions take 3 or 4 hours at a time for one quart of blood, all right? 1 unit of blood. So and most of the time I had to have 2 units because my hemoglobin count was so low, and I needed 2 units of blood. So that's the whole day in the ER, right? You arrive at 9:30, you don't get out till 6 because they can't do all the units together. They have to do 1 unit, and then they have to do the next unit, right? So and you can't be alone. You have to have somebody with you, all right? So that's where your people, your peeps come in, right? So So I've had friends who have sat with me for the whole 8 hours or more, you know, um, and they got used to it to a point where they would bring stuff to do, right? Because it's a long day. And then one of my friends who's been with me the most during all the transfusions would go out and get me lunch or a drink. She made sure I was eating during treatments, and you know, I was being taken care of. If I had to go to the bathroom, I had to take the blood the blood drippy thing with me. So I had to get out of bed. I had to, it's just all it's very um, it's not a smooth process, right? So you're hooked up to this thing, and it's dripping. It's giving you life, basically, and and I was very fortunate to have. I've been very fortunate to have lovely people with me, um, through this process, who have stayed with me and taken care of me and driven me around and, stayed 8, 10, 12 overnight hours with me in the hospital. So the blood transfusions are really important, and it's nothing to be taken lightly. If anything, it's really serious, and to make sure that all your levels are up, you have to have a good diet. All right, if you can take an iron supplement and that works for you, you can take a pill and it's going to help you keep your blood work up. Good for you. You're lucky. I couldn't take the supplements because they made me feel really constipated. So, but by now, during the last month, I found a series of things that have helped with constipation. The constipation hasn't gone away, but I can manage it a bit better, where I'm a bit more comfortable with it. Right? It's horrible. At one point, so I'm going to do a little TMI right now. I couldn't go to the bathroom for 3 days, and so this is for number 2. And it was, they had given me in the cancer treatment center a shot of something to boost my iron. But that shot just basically bunged me up. That's a very English expression, where I was just blocked, and the stool was really difficult to pass. It was uncomfortable. It was painful, right? So that one experience was the worst, I've had. Now, since that time, so only recently, I've come up with sort of a system that works for me. And I can show it all to you in the kitchen, but I'm just going to tell you all about it right now. I might do a video about it later, but so essentially the recipe is this. A half cup of soy milk, or some sort of milk that you can digest. I don't really recommend cow's milk, so some other milk, all right? And try and get an unsweetened kind, so sugar-free. And in there, you have to buy some things, all right? Because if you can't take the pills, this is an alternative that might help. So what I buy is a big thing of dehydrated spinach, Popeye style, from Amazon. And I take a tablespoon of the spinach, and then I buy capsules of dandelion, powdered in capsules, and artichoke. I think that's the combination, right? And I mean, that is the combination. And so I empty out those capsules. So I take 2 of the dandelion and 1 of the artichoke with my spinach powder, and my slightly warmed soy milk. So I have a little frother thing that warms my milk in the morning. And then I mix it, and then I do a little one of those hand whisk things to mix it, to blend it all in, because it's all powdery. So you need to use that or a blender. So I just use this hand gizmo in the morning, and I'll drink that very early in the morning. And that's really been helpful to keep me, to keep my system, my digestive system as regular as can be. Now the stool is hard and soft, if I'm the TMI, sorry, but it's manageable. It goes through my system easily, and I'm not in any pain, and it's not a huge effort to expel the stuff from my body. All right, so and I do it every day pretty religiously. And then for the supplementation, so the spinach helps with that. I've also upped my beef intake and liver intake because those are high in iron. So I cook those Chinese style. So find some nice recipes on YouTube to cook your meat. Make it tasty. And don't eat too much, just enough. Have it with some rice. I have it with rice or rice noodles or something like that. And then the other thing I've just recently started is liquid iron. So the results are out on that. I'll know on Friday when I go and get my blood work done, and I'll give you an update based on where I'm at. But I've been taking the liquid iron now for a couple of weeks, and so hopefully I have better blood panel results on Friday. So those are some of the little things that I'm doing to combat constipation and trying to keep my blood work in a place where it's healthier, all right? So may have some background noise right now, but hopefully screaming children in the background, so excuse me for that. And that's all I have for this section. And I'll do another video on blood work later on. I might even do a video of making my drink, but essentially it's all of these green powders in a little bit of soy milk in the morning. Do it at the same time every day, right? Because you want to get on a schedule where you eliminate on a regular cycle. You don't have days where you're not going, and you don't have discomfort. So those are the things that you're trying to avoid. All right? So Cancer Val loves you, and I'll see you next time. Have a wonderful, wonderful day.